I'm Dr. Pedro Castillo in Dallas, Texas. Reporting for Room Now as we cover ACR Convergence 2021. Today, I'd like to talk to you about something I found very interesting. And if you're following at home, the abstract number is 1429. This was presented by Dr. Stacy Dillon. This has to do with a therapeutic molecule called Alpine 303 that is a dual antagonist of both BAFF and APRIL. Now, this was created using or identified using Alpine's directed evolution. And we're not going to get into that right now. Honestly, I'm not sure that I could even, I'm not qualified to even get into that. But what's really cool about this is that I think it may have, and they think it may have some therapeutic benefits for patients with lupus as well as other antibody-mediated diseases. Now, what are BAFF and APRIL? BAFF and APRIL are members of the TNF superfamily, and they have different targets on B cells. BAFF has a target or that it can bind to BAFF-R, TACI, and BCMA, whereas APRIL has the targets of TACI and BCMA. And it's important to kind of notice these targets because these are seen differentially expressed on B cells during the life cycle of the B cell. And so early on, you see BAFF-R, but that is not seen in plasma cells or Ig secreting parts of the cell, of the B cell cycle. Whereas TACI and BCMA are seen later on in the middle to later stages of the B cell development. Now, BAFF and APRIL are both very important for the development, differentiation, and the survival of B cells. And so targeting these is an ideal sort of way to potentially help patients with these kinds of diseases. Now, there are these two other agents, telitacicept and atacicept, which were based on basically a wild type TACI fusion protein. And I mentioned them because Alpine 303 will be measured up against it in a couple of parts of this study. Now, these also are dual antagonists of APRIL and BAFF. But when they did a study with these on patients with lupus, they did find that many patients did not respond or they had significant flares. Up to 50% of the patients had significant flares up to about 5 to 6 months into the study. Now, Alpine 303 was, they had these mouse models where they did a KLH immunization, and they measured the antibodies in these mice after Alpine 303 was given or these wild type TACI fusion proteins. And they found that Alpine 303 significantly outperformed the atacicept and telitacicept by decreasing significantly the IgG and IgM antibodies. There was also a mouse model of lupus that was treated, and they found significant decrease in nephritis, BUN, renal immune complexes, and an increase in survival. So overall, this is very exciting, and it's exciting because we do have B cell targeting therapies. I mean, we of course know about rituximab, and but the difference here is that the anti-CD20 action of rituximab does not target directly the later stages, the plasma cells that are antibody secreting, whereas this medication would target the whole cycle. So I'm very excited to hear more from this group. They're going to start enrolling adult patients or adult volunteers, into the phase 1 portion of these trials. And that may start as early as this year. So we'll see where things go. Thank you very much for joining us. And you can hear more at Room Now. This is video 2. Hi, I'm Dr. Pedro Castillo in Dallas, Texas, reporting for Room Now as we cover ACR Convergence 2021. Today, I'd like to talk to you about abstract number 1946. This is presented by Dr. Silja Waterdahl Siversen, and it's a presentation on the NORDRUM-B, or the Norwegian Drug Monitoring Trial. This is an open label study where they looked at patients who are on maintenance therapy with infliximab for a variety of inflammatory diseases and tried to see if the benefit, if there was a benefit for therapeutic drug monitoring versus standard treatment with infliximab. And so this was done over, this is a national study. It was included 21 hospitals, 454 patients. They were divided in half. There were patients who were, the inflammatory diseases were psoriatic arthritis, rheumatoid arthritis, psoriasis, ulcerative colitis, and Crohn's, as well as axial spondyloarthritis, which I think made up the largest proportion of those patients. Now, this was a 52-week study, And they found what the primary endpoint was to see if you could maintain their low disease activity or sustained disease control by DAS 28 on, sorry, I messed it up.
You're good. You're good.
All right. 1, 2, 3,
Oh,
4.
hey, hold on. Let me hit my mute.
Oh,
okay.
Okay.
Go ahead.
3, 2, 1. Hi, I'm Dr. Pedro Castillo in Dallas, Texas with Room Now. We're covering ACR Convergence 2021. Today, I'd like to talk to you about the abstract 1946 for those of you following at home. This was presented by Dr. Silje Waterdal Siversen. This is going over the Norwegian Drug Monitoring Trial, or NORDRUM-B. This is a part of the trial that was looking at therapeutic drug monitoring versus standard therapy for patients receiving infliximab for a variety of inflammatory diseases. Now, these inflammatory diseases spanned several, including GI and arthritic types of diseases and skin disease. So psoriatic arthritis, rheumatoid arthritis, psoriasis, axial spondyloarthritis, ulcerative colitis, and Crohn's. Now, this was done over 21 different hospitals with 454 patients, divided in half, where half of the group would get the therapeutic drug monitoring, and the other half would be standard of care. Now, therapeutic drug monitoring was basically trying to keep an infliximab level of between 3 to 8 milligrams per liter. The standard therapy was to use basically clinical judgment based on clinical factors of the physicians treating these patients to decide if they wanted to change the dose of infliximab. The idea here is to see if we can try to minimize the amount of patients who are getting an overdosed amount of medication, and also ensure that patients are within the therapeutic range, as well as prevent people from, quote unquote, failing the drug when in fact, perhaps they were just outside of the therapeutic range. The primary endpoint here was for all diseases, all the diagnoses together, to maintain or sustained control of the patients. Now, these, of course, remember, are infliximab treated patients who are on maintenance therapy. Now, in the therapeutic drug arm, they had 74% sustained control, whereas in the standard of care, it was 56%. And this was a significant difference when you're talking about the primary endpoint of meeting all the diagnoses together. When you're looking at the individual subgroups, AS, or axial spondyloarthritis, as well as ulcerative colitis, were significantly different, with the rest of them also being numerically different. In other words, better than the standard of care for the therapeutic drug monitoring arm. But those other ones were not significant in and of themselves. But again, remember, that's a subgroup analysis, whereas the primary endpoint was met for the whole group altogether. This is a really cool study because it basically is potentially practice changing in the future. I mean, if we have a cheap and readily available way to check therapeutic levels of infliximab on these patients, we may find that, hey, they have a too low of a level, and maybe we just need to increase the dose. Or perhaps they have a very low level, and in fact, they have a high antibody to infliximab, in which case we need to switch therapy. Perhaps we find that some of them have a too high of a level, and we can decrease the frequency or decrease the dose. And so that can be important for a lot of reasons. The other thing that they did find in this study that was interesting was that the dose variation was actually lower or better in the therapeutic drug monitoring group. In other words, they didn't vary the doses as much in the therapeutic drug monitoring group. I would have thought that it would have been the other way around, but in fact, those who were just getting standard of care are the ones who changed more often. And the other thing that was interesting was that patients who received standard of care therapy more often had levels that were below the goal. Now, this was an open label study, which of course presents its own various limitations, but it's very encouraging to see that this may be an avenue for better targeted therapy for those patients. Thank you very much for joining me today. This is Room Now. You can learn more at roomnow.com, and you can follow me on Twitter at _Castillo_Pedro. Thank you very much.